There was a big section on it. Yeah. Okay, I'm going to call the Economic Development Committee meeting to order. I believe we have a presentation by our Economic Development.
Good evening, Council. I'd like to introduce Megan Van Ravensway, who is the Executive Director for the Northampton County Historical and Genealogical Society. She's got a presentation for you.
Perfect. Just for the record, is there any courtesy of the floor? Seeing none, we'll move on. Thank you.
Sorry about that.
Greetings, everyone. Thank you so much for having me tonight, and thank you to Tina for inviting me to present to you. So I have a nice little PowerPoint. Tina asked me to share with you what's going on at NCHGS, what we're up to, and some of our really exciting future projects. So I wanted to bring you some good photos to accompany what's cooking. Of course, the pandemic was very difficult for us at NCHGS, but I'm pleased to share our numbers are tracking beautifully at NCHGS, and it looks like we are absolutely going to surpass 2019 numbers. So we're grateful to the county. You have provided us with some desperately needed general operating funds and project funds. So thank you to you guys, and of course the DCED team and Executive McClure. We greatly appreciate that. So we are NCHGS. You might know our flagship site, the Sigel Museum, the best. That's of course located on Northampton Street. This is our flagship site. Many things are going on in that one building if you have not had a chance to visit. So we have an auditorium space there. That auditorium space hosts monthly movies, event rentals, and public programs. Then, of course, we have our exhibitions. We present the history of Northampton County in entirety. So we begin all the way with our Lenape friends up until modern day. So the space also has permanent exhibition spaces as well as changing exhibition spaces. We present decorative arts, paintings, watercolors, textiles, everything. It's a beautiful space. If you have not visited before, please reach out to me. I'd be happy to give you I call it the nickel and dime tour of the site, because you can certainly spend multiple hours at Sigel Museum. Most notably, and I think it got passed out to you, our postcard. Yes. This is a really important exhibition that I would really love for you to join us for. It is currently on exhibition. This is called Another American's Autobiography. It's a project in collaboration with the Petrucci Family Foundation's collection of African-American art. So they have an amazing collection of over 400 pieces in their collection. So we have 25 on exhibition right this moment. It's going to close on Heritage Day, July 10th. So please come by, because we really want you to see it. What's going on there in the museum industry as historians? Of course, we looked at the activities of 2020 and 2021, and we really wanted to present a new exhibition to the community that nodded at what was taking place around us, right? So if you allowed me to read off, we have some questions that we're actually asking the guests to consider. What's taking place here is a discussion on American patriotism through the Black community's lens. So what does it mean to be patriotic? Who comes to mind when we think of an American patriot? How can we redefine and reimagine our symbols of patriotism, our expressions of allegiance? So we aim to affirm the role of the Black community in shaping our national identity through these beautiful 25 pieces. I think I have another one. Fabulous. So you see there sculptures, textiles, quilts, some incredibly important national and worldwide pieces. Artists are represented in this collection. You see Sean Kimber's quilt in the back there, in the background. Sean Kimber is a former Lafayette professor. She's a mathematician, and she uses her quilt making to express her feelings about what's taking place in the community. Her quilts are now being collected by the Smithsonian Institution. That piece right there is, as soon as it's done with us, it's going to go to the National Quilt Museum in Nebraska to be part of their collection. So really important pieces. We also have 2 Faith Ringolds that were printed here in Easton. And then, most notably, we have Kehinde Wiley. Kehinde Wiley is the artist that painted President Obama's presidential portrait. We have one of his prints at the museum now. So please join us. Of course, at the museum, we also have our museum store, which has been busy, I'm happy to share. We also have a discovery room. And this is a hands-on space for kids, the guardian at the museum, just to let the kids' hands go, and they can paint, they can play, do dress up. It's a really, really nice space. I'm pleased to share with you, field trips are back. We just had our first field trip last week. This is them. This is Wilson High School's art class. I can't tell you how much my team and I were fawning over, I think, 16 kids, but it really made us feel like things were normal again, because we haven't seen kids since 2019. So we're pleased for that. But we have 4 other trips coming in next week and the week after. So we're thrilled for that. Another thing that's taking place at the Sigel Museum in that discovery room, this is a collaboration we have with Cops and Kids of Easton. As you know, they're a group that promotes literacy in our community. We let them use space on the 2nd floor for free. So there's reading, story time. You see Judy Dickerson in the center there, critical volunteer in our community. And then finally, 3rd floor of Sigel Museum, that's our administrative spaces. That's the Jane S. Moyer Library and Archives. So we're constantly welcoming in researchers, like reporters, Lafayette College newspaper writers. It's a wonderful space, and we're happy to help people with whatever research project they're working on. So you also know the Ilick House. This is one of our properties. It's mostly collection storage for us, which is its own problem. But there's also some interpretive space there in the front of the structure. The structures are typically open on July 10th, Heritage Day. You know Jacob Nicholas House. This is ours as well. That's the interior of Jacob Nicholas. This is a really fun property for us. It's tiny. It's the size of a postage stamp, but it allows us to present the story of a Durham boat captain circa 1810. So this is the middle-class family story, which is very exciting for us to be able to tell. And here's Bachmann, my baby. So this is the 1753 Bachmann Public House. This is one of our critically important structures. Field trips go through the site. We host activities, normally pre-COVID, in those tiny little rooms. If you drive by, you're gonna see scaffolding on it. Of course, it needs a new roof. Before the pandemic, that roof cost me $70,000. It now costs me $140,000. So throughout the pandemic, we were raising a significant amount of funds, and the county did give us some funds towards that roof, so we're grateful for that. Scaffolding just went up, so you will see RJ Door's crew put a new roof on that baby for us. It's wood shake from Canada, and there's a tariff. Cha-ching. Yes. And then, of course, you know our Cressler Garden. This is right next to the George Taylor House. It's a tiny little piece of property. We just consider it one of our pocket gardens in downtown Easton. We actually have kids there. It's one of the stations on the field trips, so they can go out there and read books and the such. It's really cute space, but obviously very small. So lots of activities going on. We welcome the public. This is a brand new Erie Easton walking tour. So we don't go too far into haunted history. We like to tell the stories that are creepy that actually really happen here. So we have our costume guides, and that just kicked off this past Halloween and was a huge success for us. So it was really nice having people down. Of course, then they went out to the restaurants and could shop the boutiques. So it was really nice bringing some tourists to downtown Easton. And here's some more shots of that. Oops, sorry, I went a little fast. And then, of course, this is Heritage Day outside of the Bachmann Public House. So this leads me into collaborations. So when GEDP needs help, we're there. When Cops and Kids of Easton needs help, we are absolutely there. Children's Home. We have so many partners. It's unbelievable. We believe in working smarter, not harder. We nonprofits are not in competition with each other. We're here to build each other up. So that's my perfect segue into Lehigh Valley Passport to History. This is our baby, and Tina and Mark get drug into this all the time. This was founded over 10 years ago by us at NCHGS. I chair the committee. Believe it or not, it's over 50 area museums, historic sites, cultural attractions in 8 different counties and 2 different states. This thing is growing more than I can control it, right, Tina? So we meet monthly, really great meetings. This was really important for us throughout COVID. We were meeting monthly, and all of us were saying, oh my gosh, what are you doing? Are you wearing gloves? What's going on with the mask? So it's really almost like a therapy group, but in normal times, it's a wonderful collaboration. So we partner together. For example, we have a teacher's night out coming up at the Canal Museum. Over 20 area historical entities will welcome, I think it's about 25 teachers to earn Act 48 credits on this evening, and they can find out about all the different educational opportunities in our county. And then, of course, we have the Passport to History Month. It's coming up. July of 2022 is our Passport to History Month. So about half of the partners throughout all the weekends in July will be open for free, offering activities to the community. And again, Norco is a huge piece of support for us, so thank you. You actually fund the marketing coordinator who helps manage this throughout the year. So please, if you're on social, please like the Passport to History site. And then there's a few more shots from various different partners. And this is what I'm currently working on, everybody. So 2026 is staring down the barrel at us. As you know, 2026 is the 250th anniversary of the adoption of the Declaration of Independence. We are one of the early reading sites here in Easton, so critically important for us, and we're seeing it as an economic driver. So for the past 2 years, I have been working with Lafayette College. We've been looking for every grant possible to help us present exquisite exhibitions, tours, activities for the tourists to come and enjoy. We've applied for federal grants. We've applied for PADCED funds. We are looking for every penny that's out there. The thing that we're worried about is that pandemic really hurt us. Your nonprofits are struggling right now. You're looking at the only full-time employee at NCHS right now, and that's going on at all your nonprofits, and we need to gear up and be ready for 2026. While that feels really far away, it's not. The federal government really wants us to be ready for 2025, 26, 27. If I'm gonna have an exhibition on the walls in 2025, I gotta start now with that research and the preparations for it to have it up. So I'm in Tina's ear a lot, I'm in Executive McClure's ear a lot, and we're so grateful to the county for that support. But our main goal with 2026 is to, of course, present the story of our founding fathers, but the unheard stories. The enslaved folks who were here in Northampton County, the women, the Lenape, other stories that we certainly need to tell. So that's all I have for you. Thank you so much for having me tonight. Please know how much we adore you guys so much, and thank you for all your support.
Thank you. Does the committee or anybody have any questions? John?
Sure. Thank you for coming. Nice presentation. I was just wondering if you could share with us who Jane S. Moyer was and why we named something after her.
I didn't have the pleasure of knowing Jane. She passed away a couple years ago at about 103. The library that is currently on the 3rd floor of the Sigel Museum was at the Ilick house. Jane is just a beloved librarian. She whipped us into shape. Her volunteers are still working under her direction at the library, but an incredible, incredible resource. She was incredibly giving as well. When she passed, she left us a nice gift to behoove the library. But again, it's our big wish that everybody feels welcome at the library and at Sigel Museum and having access to that space. The library is staffed Monday through Friday with volunteers. So we have about 15 volunteers or so in the library. Did you know Jane?
I did, and I thought it was worth mentioning. She worked until she was over 100 years
Yeah.
old. So
Yeah.
I think we can all take something from that. And the other thing I wanted you to touch on is you talked about the Bachmann House as a place where the declaration was first read. Could you share with us also why it's significant to the courthouse?
Sure. So I will correct you there, sir. It was read at Center Square, the
Okay.
Declaration on July 8th, but you're very close, so you get full credit on that.
One block off.
Exactly. I'll forgive you on that, but I think I'm on the record, so I have to correct you. But indeed, Bachmann Public House was the first county courthouse. So on the second floor of Bachmann, please come for a tour. You can see the original space that we have interpreted with the benches and the table, but it's a beloved place. Of course, it was a tavern, so, and it was there before the courthouse was built in Center Square. It was also the space where the postal system might go through, visitors might go through, people would get together and chat. And I think that's why it's a beloved structure, is it wasn't just one person's home forever. It really was a community space, and I think you can feel that when you go in there. It's a very friendly space with a very expensive roof going on it.
I'm well aware of what it's cost to keep that place up over the years, so
Yep.
thank you for keeping it up. Thank you.
Absolutely.
Thank you. Any other questions? Thank you.
Thank you.
Mr. Chairman, before I introduce your next presenters, I just want to say to Ms. Van Ravensway, who has one of the coolest names, by the way, in nonprofits in Northampton County, she is so very serious about educating folks about our history that she is a very valuable asset personally, in addition to the Historical and Genealogical Society's obvious benefit to our citizens. With that, I'd like to introduce Star Community Health, who's going to make a presentation for you today. They came at my request because I had the pleasure of touring their facility on the south side of Bethlehem. And if you get a chance, I suggest that you too do that. It is unbelievable the work they are doing there and the population that they are serving there. You're going to hear all about that, I suspect. On my mind is former County Executive John Stofa, who, as you know, just passed away, and he was a staunch advocate of the creation of a health bureau. And as we begin to study whether we need a health bureau in Northampton County, I can say this definitively: if we decide we don't need one, one of the reasons is going to be Star Community Health. And with that, I'll introduce them.
Thank you, everyone. My name is Laura Hetrick, and I am the Senior Operations Director for Star Community Health. This is Mark Roberts. He's our Executive Director. And we appreciate your willingness to hear us today, and so we can educate you a little bit about what Star Community Health is. So Star Community Health is a federally qualified health center. And we came into existence about 2 years ago. Of course, we had our certification through the Health Resources and Services Administration, and then COVID hit. So it's been an extremely interesting time. But a federally qualified health center is governed by the federal government in addition to the state. And they govern us with a significant amount of compliance. The focus is really quality. We are, the goal for us is to be the primary leading health center in our area. And we service individuals who are underinsured, undocumented, also medical assistance insured and Medicare insured. We also accept commercial, but it's mostly for those who are the indigent population within our county. And honestly, in the packets that I gave you, and I very much apologize, I didn't know there were so many of you. So I will send electronically the information that are in those packets so that all of you have it to observe at your leisure. Star Community Health, right now we have 5 bricks and mortar locations, and the ones that are in Northampton County are in Fowler, the Fowler Building, which is at 511 3rd Street, And that building has been tremendous, except for parking right now because they're doing construction. But it has been tremendous. And we actually have done a major overload of the dental office, and we have expanded the chairs in our dental site to 10 chairs. So that is going to offer dental care to our population from all over. A patient that comes to Star Community Health comes to Star Community Health for primary care mostly. However, we also have women's health care, kids care, pediatric care, and dental care. We also have internal medicine, and we have same-day care, walk-in care. Yes, and we actually are at some of our buildings, we are expanding the same-day care to Saturday hours, which is crucial. The goal for our patients is to not access the emergency department. Come to us. We'll take care of you for your cuts, your bruises, your sprains, your minimal, stitches, et cetera. And so we're trying to divert the expense of emergency care to our setting, okay? A lot of the patients have tremendous stories. We have what I term as wraparound services also that are affiliated with each patient visit. So a patient that comes in, if they are struggling socially for whatever reason, we can have them visit a social worker, no charge. They also can see a financial counselor. They can see an RN case manager to help navigate the healthcare system and coordinate it. We are also working on an initiative of what we're terming as a healthcare partner, meaning some of the patients who are significantly chronically ill, that are not the most compliant, need someone to be accountable to. It's many of those individuals who don't have the social circle that many of us do. And they need to basically get encouraged to seek care. So that's one of the goals that we have. Our dental program, we're finding that many of the individuals that come to our organization that are undocumented or underinsured, their culture is not to be evaluated in mouth care. So many of the population, they're doing well, but their mouth care is compromised. So we actually have 3 dental vans, but our Bethlehem dental van is a 2009 version of a RV, essentially, that's been modified to treat our dental patients. So has been a significant amount of repairs that have been needed to the van. So one of our goals is to try and replace that van so that we can continue to service our patients, mostly school children. We do get a grant from the Department of Health to take care of, we have taken care of over 900 school-age children. And I can tell you that we have actually individuals who are maybe going out for football practice. When you have the mouth guard, they're running up to the van and asking if we can help them because they can't get their mouth guard in and they can't practice. So it is a significant need for our community. And we are very, very proud to be doing what we're doing. And as a whole, Star Community Health has serviced over 42,000 patients. Our community has about 58% Hispanic population. Our board is made up of a significant portion. It's basically a replica of the patients that we serve so that we know what the needs are. Culturally, ethnically. So it's been a tremendous journey, and we anticipate growing significantly. So I'm going to have Mark have the opportunity to speak as well.
So,
Thank you.
And good afternoon, everyone. Thanks for having us in to talk about our program. A little bit of a recap on federally qualified health centers. We are actually a lookalike health center, which means that we meet all the regulatory requirements. However, we receive zero funding as of yet. And for a center of our size, as she mentioned, roughly 40,000 patients per year, 140,000 plus visits per year. That would equate to $5 or $6 million a year in federal support, but we don't receive any of that. We will be submitting an application as soon as that opportunity becomes available. But more about the work that we're doing. So what do we do here in Northampton County? Well, we serve roughly 19,000 people in the county. 65% of that are Medicaid, and this is, you'll see this in the packet. The bulk of the people that we serve, although we're open to everyone, and we don't turn anyone away, whether they're insured, uninsured, underinsured, it doesn't matter. We see everyone, particularly in the case of dental patients who you may remember years ago, although I recall it's not that long ago, a child actually died in Maryland because he had an infection that was untreated. That was a wake-up call for all of us to do something about the dental care that's needed. So we've opened, as she said, 3 vans to serve our area. There are kids who actually reach high school without having gone to a dentist. So our charge is to make sure that doesn't happen. And so the vans are absolutely imperative for that. The vans that we have are dental vans. These vans can actually be constructed to both treat medical and dental at the same time. 2 chairs, 1 medical, 1 dental. They can also convert to do both dental or both medical. So whatever the need is, wherever we find that, that's what we do. As a federally qualified health center, we are required to report annually the work that we do. We report that to HHS. They then, in turn, of course, report that to Congress. Congress then decides if this is a successful program. And since its inception in the 60s, this has been one of the best returns on the federal dollar in terms of programs. So of all the centers across the nation, we continually provide great care at low cost. And we seek to, as she said, prevent people from having to go to the ER because that's 3 times the cost to a patient. And we provide primary care, all the departments she mentioned. We also have specialty care. The specialists that we work with, that we network with, they have to abide by the same charges or similar charge structure that we give our patients. What does that mean? That means that if we discount, when we discount those charges, those specialists have to do the same thing. That's a requirement of the program. So patients are assured that if they go to a specialist, they don't have to worry about paying thousands and thousands of dollars or hundreds of dollars for a visit and further thousands of dollars for treatment. So that is what a federally qualified health center program does. And there's so many other programs that we're associated with. There's a homeless program, a homeless grantee network. There's a primary care grantee network that we are in, and there are others as well. So we plan to expand. As I said, this year we've seen roughly 145,000 patients. Next year we are on point to see 160,000. That's our goal, and we will do it. We have a great team, and we're expanding our specialties. As we refer, one of the issues, and I'll turn it back to Laura on this next point, but one of our issues is that when we refer our primary care patients to specialists, a large % of them do not go. That's a barrier to care, which we are in business to prevent or to remove. That barrier is because they don't have transportation. They can't afford the costs. Or in a lot of cases, we're finding out through our information that they forget in many cases. But the large portion of this is that they can't afford it and they don't have access. So we are working on removing those barriers so that they can get there and that their chronic diseases do not escalate to the point where it's super expensive to treat or there's not much that anyone can do about that. I have to tell you very quickly that I started off in IT years ago, way too many years ago. As an IT person in healthcare, I attended a conference that showed us what the triggers were for asthma, and as an IT person, I was hooked. I said, I have to be a part of this. Because when you realize for those chronic diseases, for asthma, for so many others, there are things that we can do as healthcare providers to prevent this and prevent it early on. And these programs can be structured so that patients actually create their own solutions. As a parent, do you want your child to be able to play soccer by the end of the year, by the end of the summer? Yes, well, how do we do that? It's our job to create that solution, track it with a network of people inside the center to say they are meeting their goals, the goals that they defined. And at the end of that process, everyone wins. And that's why we're here as a federally qualified health center. And that's why we're expanding. And that's why the vans, the medical vans and dental vans will help us get there and reach more patients and provide more care. So.
See why he's a leader? I'll tell you what. No, he's really great and passionate, as am I. So one of the things that we do with regard to barriers is we have a unit of individuals, they're referral specialists, and they close the loop. So we can actually figure out who doesn't go to what's ordered, and we can figure out what the need is in order to get them to where they need to be. So we're very, very passionate at Star Community Health. And those of you that have the packets, you will see that we are trying to showcase some of our settings. One of them being Siegel is the most recent. It's the Siegel Center in Allentown, not to be confused with your Siegel Center. But we are actually doing a grand reopening of that setting. And I know that's in Lehigh County, but I still wanted you all to be available. If you're available, to please feel free to stop by. We gear that particular program to patriotism because it's National Armed Forces Day. So we are going to have sergeants there, and the kids are going to be able to write little notes to the deployed servicemen and women. And we're going to be able to color pictures and send them. So we'll send some joy wherever they are. But in closing, we are very proud to be here. We very much appreciate your willingness to listen to us and support our cause.
One thing I just want to add before we go is I always take this chance to mention that our Chief Medical Officer, Dr. Alicia Walty, has a great approach to how she provides care. She spreads that throughout our clinical team. Having said that, our quality measures, how well we provide care, they not only exceed what's going on here in the state, they exceed the national average as well.
Yes.
So when you talk about hepatitis, when you talk about diabetes, when you talk about all of the other diseases and so forth and chronic conditions, she does such a great job for our organization that she has consistently exceeded state and national averages.
Yes.
And that, when I came into the organization 6 or 7 months ago, I was super impressed with that. That's not an easy thing to do.
No.
So, thank you all. We really appreciate it.
Yes.
Thank
And
you.
please visit our sites.
Yes, whenever.
Thank you.
Thank you for the presentation, and more importantly, thank you for what you're doing for the community. At this point, questions? Yes, John?
Great presentation. Thank you very much for everything you guys are doing for the community. I just have a couple questions. You said you had 5 brick and mortar locations. You said you had one on 3rd Ave in Bethlehem, Fowler Building. Where's the other one in Northampton County?
On Ferry Street.
Ferry Street?
We have women's health and pediatrics. And we also have, on Ferry Street, just the other side, in Santander Bank. Above the bank, we have a dental office.
And you said you don't get federal funding at this point. Where do you guys get most of your funding from?
We have grants, community grants, and other grants that we solicit funding from.
So there's no state funding either? It's all
There's
it's all
very-
grants.
Okay.
And do you guys focus on education for patients that come in with eating, diet, exercise, that kind of stuff too?
Yes.
Is that a big focus?
Do wellness, yes. Actually, part of what we do is we are a teaching organization too. So we partner with St. Luke's and their residency program. So their residents come through our settings as well. And so we are a teaching organization. We have students that also go through with all of our service lines. In addition to, we partner with DeSales for their advanced practitioner programs. We also partner with Northampton Community College on their dental assisting and hygienist program,
Fantastic. Thank you.
of course.
Any other questions? Thank you.
Thank you.
For the
Thank you.
presentation. I think that ends what we had on our agenda. So if there is a motion to adjourn, unless there's anything else, Ms. Smith? Nope.
Good evening, good afternoon. My name is Nick Sapitsaris. I'm the owner of Nick Sapitsaris and Associates, as well as Lakos Construction. I am here to hopefully have presented alerta. Unfortunately, I don't see myself on the agenda. I have counsel. His name is Tom Bowen from Stevens and Lee. I guess I can come back another time. The reason I'm here, of course, is I'm purchasing the Dixie building, the Dixie Cup building. Yes, so I took a nice, wonderful trip from New Jersey. I'm here without my people and without counsel, and this is what happens when you come alone, so. But I like the trip, and I'll go downtown and enjoy your beautiful downtown. So I'd be more than happy on the record, but off the record to tell you for a minute what we're up to, or I can come back at another time. I don't know if you have an open part of your agenda or not.
Yes, in the beginning of it is public comment, courtesy of the floor. And, I mean, if you want to give something real brief, I'm sure a lot of us are very curious, but I would really appreciate if you worked with Ms. Smith and got actually something scheduled, a presentation, and you know.
I will. I have
So
a
if you want to do
presentation.
something real quick,
I mean, I don't care. I can leave you with what I brought. It's paper. You can have it. I brought it. I'll bring more next time, so. If you don't mind, I can just give it out. Is that
Sure.
okay? Okay.
Mr. Chairman, if I could,
Sure.
as a chief executive officer of the county and someone who is ultimately responsible for making propositions to council about how taxpayers' money is handled, including giving it away, this is the first time I'm hearing about this project. So it'll be interesting to hear what he has to say, but I would not advocate giving a tax break to a project that I haven't even been presented with yet.
Exactly, and that's, I believe that's why we were.
And as important as this oversight hearing would be, if we actually had the information in advance to review and prepare, we can't make any decisions about giving out tax breaks without having been approached about the project. It's not how it works here.
I agree, and that's why I said that we need to come back and go through economic development and administration. Maybe I didn't make that clear enough, but I just was kind of curious.
No, it's your prerogative to take, but what I'm saying is, I am not supportive of this LERTA because I haven't heard about it.
Okay.
I'm not, I'm withholding judgment until it actually gets presented to us, till we've had an opportunity to analyze it and see if it is a project that we'd recommend giving a tax break from our real estate property taxpayers in Northampton County to support.
Absolutely, Mr. Executive, and I apologize, but we do know we're putting the cart before the horse here, but the cart looks so shiny and nice. It's been there so long that, just very basic, because you really need to start with our economic and administration. So if you want to just give us a real basic idea of what you're thinking.
Really quick, and I apologize for showing up like this. You can have this. Yeah, and again, I apologize. I'm represented by counsel, good counsel. I thought I was on the agenda. That's it. This is fine. I thought I was on the agenda. I have an email. You're the boss of the county, I assume, which, and I respect that. It's not my first time in a political arena, and I apologize. We don't like surprises. Again, I had very learned and good counsel. Perhaps I misunderstood. I thought I was making a presentation. It's not the way we do business to just show up. And again, for the record, I'm not asking for a vote now or this evening. If it's not properly on the agenda and it hasn't been looked at, I am not asking for a vote. I thought since I drove out from the office, I would give a really quick presentation, that's all.
Before you start, could you please give your name, spelling of your name and your address, please?
Yes, my name is Nick Sapitsaris. I am from the village of Ridgewood in New Jersey. I'm an architect as well as an engineer. I own a construction company, and I am the contract purchaser for what is known as the Dixie Building here. I don't want, again, I don't want to take up too much time.
Excuse me,
Can you just spell your last name?
Oh, sure. It's at Sapatsaris. I can give you it's on the second page, yes, thank you. Yeah. It's T as in Tom, S as in Sam, A as in Adam, P as in Peter, A as in Adam, T as in Tom, S as in Sam, A as in Adam, R as in Rick, I, S as in Sam.
Okay.
Nick Sapatsaris. So, again, I'll go quickly, and I'll come back when I'm formally on the agenda. But I do appreciate the few minutes that you'll listen to me. I'd love your feedback as to what we plan to do with the building. In terms of background and how we came to Pennsylvania, we are from New Jersey, and we were driving our middle daughter to a place to get educated. And since my wife and I are addicted to real estate development and adaptive reuse of historical buildings, and I saw in a prior presentation, a very interesting presentation about your history. It's amazing. Basically, we're here because we buy old buildings like this, we fix them, and we keep them. In your package is an identical project which we completed in New Jersey, which is called Gunther Mill. It's a 218,000 square foot adaptive reuse project. And I'm pleased that we won the New Jersey Smart Growth Award for it. Again, as we were driving to drop off daughter number 2 to college, and you have lots of colleges out here, that we learned about, out of the corner of our eye, we saw a big cup. And it drew us, this was not, from my understanding, for sale, this property. It drew us to the property, and we saw pretty much the identical twin of the building we just completed in Dover, New Jersey. A few meetings later, we were able to sign a contract with Mr. Riebman, Wilson Park LTD. We are completed with our due diligence at this point. We're moving forward to closing of the property. The use of the property will be identical to that which we had successfully completed in New Jersey, which is a last mile logistics facility that can take people's offices, their processing of their equipment, and the storage of their equipment. All the proposed uses are in compliance with the uses that are permitted in the zone. We're not asking for something that's not permitted. And all of the future uses will be what is permitted. That's the bottom line. We're not looking to do something very different. We're going to put quite a bit of love and attention into restoring the building and the cup. We're not going to, if not for the cup, we would not be here. So it's there. It needs some love and attention. And again, I don't want to take up too much time. I'll go very quickly through this thing, and I'll come back and formally present it when we're on the agenda. But it is the Dixie Building. My firm is a fully licensed architecture engineering firm, Nick Sapatsaris & Associates, since 1992. We do all design, historic preservation. I sat on the Historic Preservation Commission in the village of Ridgewood, where I live, and I know the importance of keeping old buildings and restoring them. So we are architects, engineers. We are also contractors, self-performing contractors. I've owned a construction company since 1992. And the reason that that's important is because to do adaptive reuse and bring back these buildings, you need to know something about construction. And so we've done the same identical project again in New Jersey, and we own our buildings. This is not something where we flip them or look to do some type of arbitrage. We like them when we buy them, and we enjoy what happens to them when we're done. Really quickly, this is the existing building on the next page, existing condition. It needs some help. We're looking to make it look like it used to. In the second page, you'll see the proposed schematic rendering. The existing Dixie cup needs help, like I said before. And then very quickly through the next 4 pages, this is not a dream, although we like to think about it. The yellow that you see on the second, third, and fourth pages are actual interest from real tenants that are permitted in the zone to rent the building. These are nice, we basically have nice buildings for nice tenants, and the yellow that you see are commitments that we have from good corporations that want to have a small office, take their widgets, store them, process them, and get them to the customer. For example, in our other building, We have 60,000 square feet of Girl Scout cookies. I have 3 daughters, I thought they just appeared, and that was great, and you had to buy a lot of them too. But what happens is they come in tractor trailers, they must be broken down from those boxes, and then the Tsapatsara's family, who has 3 daughters, has to get maybe a pallet or something, I don't know how many we buy, but they come, and that's a typical tenant. So they have their offices there, they have their breaking down of the boxes there, and they store the boxes there. And then from there, they get to the last mile, which we've learned, and we're quite impressed, although we need to learn more, about the Lehigh Valley. This is the place to be for last mile. We have, my wife, Stacy, is a broker, and she's heard from a lot of good tenants how they want to be an hour from Newark, and I believe 5 hours to 1/3 of the American population, with good people that live here to help you get it done. Our last project, we know exactly how many employees we have from 0 to completion because we have electronic access systems. And so right now, in a 218,000 square foot building, we have 200 new jobs. So in a 600,000 square foot building, we're fairly certain that there'll be at least 600. That's not by empirical data, but we know how many people have access to the building. And at the end, you see the vision of the building from above, Dixie Cup aerial image. You see Gunther Mill aerial image, which is similar. It's the one corner is identical to the Dixie building, and that's the building that we won the award for in New Jersey for redevelopment. I'd like to also show you the pre-post pictures of our property in Dover, New Jersey. On the left, looks pretty much like the Dixie building looks today. On the right-hand picture, you see what it looks like when it's done. It basically needs love, attention, windows. And again, at the end of the 11 by 17s that I gave you, you have some pre-post development windows. And the windows are not just important so people can see out, for the people inside. It's very, very important, especially at Dixie, for people to see in. We're going to light the building up as you're on 25th, so it comes back to life. And so those lights and the windows mean something in terms of the symbolic image that it gives the people that have lived there so long with it closed. And the final picture is basically a pre-post picture again of the property that we redeveloped, which you can see is very similar to Dixie. And the guy walking away from, at the bottom of the picture is my dad. The first time we tried to do one of these things, he's like, I don't know. He wasn't on board, perhaps. And I have a photograph of him kind of walking away. Now he's like, oh, you're going to do another one. This is great. This is, so Mom and Dad are on board too, which is important. So I've talked more than I should have, and I apologize. I hope that.
Thank you.
Again, for
We
the surprise.
appreciate it. Yes, John.
And we'll come back at the appropriate time to council.
Yeah, I just, first of all, I'm stunned. I didn't know this was underway. I mean, I'm someone who lives in the Wilson Area School District, and we have been pining for years to try to get something done there. It's come before us on several occasions. I think, was it last year, the year before, we had the mayor of Wilson Borough was here. He was interested in seeing something happen there. So I think there's a lot of interest in seeing something happen there. And this is, I hope you are successful. Now, I did have a couple of questions. I don't know if you can answer them or not, but environmental issues on the site have been problematic in adaptive reuse. Have you had a chance to look at that? And
Yes.
Is that something you've done before?
We've done the identical thing in Dover. We had asbestos. The paint that's peeling is lead. There's some tanks outside. By training, I'm a professional engineer, and so I'm not an environmental scientist, but I do know the language, and I do know what you need to do to abate a building like that safely. We know exactly how many square feet of tile there are that are asbestos in the building. We know exactly how many linear feet of pipe there are. And so we have accurate proposals from licensed professionals to remove the asbestos from the floors, remove the asbestos from the pipe, paint the building, and even outside, there are some tanks. The seller has been able to get the project up to Act 2 approval, which is very positive. And again, as far as Wilson Borough, we've been before them several times. And the school district, I'm pleased to report, as of last Monday, voted affirmatively, unanimously for our LERTA. And the borough has also voted unanimously for the designation of the area of the LERTA. So we're very appreciative of their sharing our vision to get the project done.
Yeah, I think it sounds good, but, you know, we've had promises before. There was a rezoning at one point that allowed for, I believe it was apartment buildings or condos. But your intention is for commercial, a warehouse, industrial space, am I correct?
That is correct. We haven't said we'll never do residential, right? But the plan as of today is to meet the unmet demand of tenants that want to come to this location for last mile logistics. But again, the next generation, or perhaps my daughters and partners, junior partners, one day might want to do some residential there. I haven't ruled it out, but for now, that's not on the plan today.
Yeah, again, I'm hopeful that, that this can work because, you know, one of the things we talk about here is preserving farmland and preventing, green space development for more warehouses. And if we can do an adaptive reuse of an old industrial project, I mean, this is, again, I'm optimistic, but I'm cautiously optimistic because we have had some other proposals there. But, from what I see, I'm looking forward to seeing that LERTA introduced here. And, Tina and Mark, I encourage you to work with them and
Definitely.
bring
We're
this
still getting to
forward.
know people. And again, for the 10th time, I apologize for showing up like this, perhaps without being on the agenda, and I apologize for that. But thanks for listening. I appreciate it.
Yeah, thank you.
Yeah, we're excited. We're all kind of surprised, like John and the administration including, I believe. It sounds like you did reach out to other government bodies, the two others. So I would strongly recommend before you reach back out to us to work with the administration. That's how this gets done. So
Absolutely.
Thank you.
Absolutely. Thank you very much.
good luck. We
Thank
look
you.
forward to it.
Sorry, I'm late.
Now, I'm going to call an end to the meeting. This was not even on the agenda. I wasn't going to let it. Go ahead. One more question, but
Not a question, just thank you, as the Eastern representative. That building has been historic, part of our lives for years, and you're going to repurpose it. I think it's a fabulous idea. I wish you all the best luck in the world. Since I'm going to be standing on the sideline, I'll be able to look at it and see it's getting done because I just got hired as a new football coach. Thank you.
Correct. Thank you so much. I appreciate it.
thank you. With nothing else on the agenda, I will look for a motion to adjourn. Meeting adjourned. Thank you.
I'm Lamont.
What's that? Yeah.
I'm the county executive. It's very nice to meet you.
I'm not gonna, no, that's,
What's going on yet?
but I.